thanks for the introduction, Dan. I'm just going to get my screen up here. So we're just the to be or not to be with pain, the resources to guide practice. So we are, this is kind of set up so that way we can follow a specific patient as we follow through kind of the rest of the day's presentation. And some of the goals that we have for this, or some of the objectives, is we really want for those who are in attendance to really employ the knowledge and the skills for prevention and management of acute and chronic pain, to learn to identify other programs, services, some online resources that are available for the treatment of pain as well, and then to understand some interdisciplinary skills programs that can support the patients with chronic pain as well. So this is our case study, and as Diane was saying, is that we'd like for you to really kind of keep these things in mind as we go through the rest of the day's presentations. So we will think about a 52-year-old person from Southern Alberta who lives with rheumatoid arthritis and chronic low back pain. And as we all know, that we don't always have just patients with simple back pains, or whether chronic or acute. A lot of times there's some complex psychosocial factors. And in this particular patient, one of the factors is that their inability to find consistent work over the last 8 years. So you can already see that in someone in this particular situation, there's going to be a bit of a challenge as far as finances, even as far as if they're not working, they're not going to be able to afford some treatments that may cost money, medications, different things like that. They may have to find transportation to get to certain other areas, and especially with gas prices the way they are, that's going to be very much less affordable. If they have lack of social supports and therefore not enough people maybe to help them to get to where they're going, and especially if they're geographically isolated, going right back to that, the transportation issues. But if there's even some resources that may be available in urban centers, but not in rural centers, and fortunately with the pandemic, there's a lot more virtual resources that are now available. But these can definitely have an impact on a patient trying to manage their pain. What if we were to add a traumatic history? So what happens if they've had, whether it's trauma due to their pain itself, or sometimes even trauma that's not related. So they may have had a history of abuse when they were younger or as a teenager, maybe they're in an abusive relationship. Those types of traumas can actually have a negative impact on their ability to cope with pain. And then if you take all of that into consideration and consider someone who may have pre-existing depression and trying to manage that, and maybe even on the verge or on the edge of even thinking or contemplating suicide, you have a patient who is quite complex. And how do we deal with a patient like that? And especially if you are a family physician in a small community, what kind of resources do you have to access? And this is what we hope to be able to provide with the conference today. Now, occasionally, this patient can see a former GP in Lethbridge, which may be a larger center than what you might be at, but at the same time, these are some of the barriers that exist. So as we think of this particular case study, and as we go through the rest of the presentations, well, one of the things that just to kind of give you a bit of an idea of the order of things. So if we kind of go through the thought process of you have this patient, and they need a bit of a diagnosis. Maybe they do not have the diagnosis of rheumatoid arthritis yet, but they want to figure out kind of what's happening, or what's happening with their back pain at least. So one thing, of course, is to talk to your family doctor, and then they might refer you to a rheumatologist. So our next speaker will be a rheumatologist, and we'll hear from them today. If the patient is, with their pre-existing depression, suicidal ideation, now they're kind of thinking, wow, this is not great news for them. And because of their history, they might start to contemplate, or their risk of suicide might increase. Well, how do we actually know that? What is that person's suicide risk? And we'll talk about some suicide risks in that regard. Now, let's say that this patient is quite receptive to this diagnosis, or they've been able to deal with the suicide aspects. And now what? Now, what kinds of resources can this patient access given where they're located? And we'll go through some online resources, of course, that might be helpful in managing chronic pain. And then sometimes, despite having the accesses or doing whatever you can, you may even have a patient who may be wanting to consider medical assistance in dying, or MAID. So we have a speaker who will be talking about MAID as well. And then lastly, let's say, not lastly, but second to the last, I should say, all of these topics are quite difficult when you're trying to talk to a patient as far as how do you talk to them about suicide or if they have trauma. And so we'll have a speaker as well addressing some of these uncomfortable and difficult topics in a trauma-informed way and how to actually do that. And so lastly, let's say they've tried everything. Is there any kind of novel types of treatments? What about things like psychedelics? Is that a possibility? And that's how we'll be ending our conference for today. So thank you very much for participating in today's conference. We hope you enjoy the rest of the day's presentation.